I'm Natasha Jones, Director of Customer Service for King County, and this year we're doing something different with the Innovation Awards for Service. We're not just honoring one recipient, we're honoring teams in 3 departments: Public Health, Community and Human Services, and Metro. And at their insistence, we're also giving special recognition to the Facilities Management Division and the Office of Emergency Management, because our honorees said they could not have accomplished what they did without the support of all of these departments. And what did our honorees accomplish? Well, in a year like no other, they worked across departments and with other government and community partners to reduce the spread of COVID among our region's most vulnerable populations hit hardest by the virus, many of whom are Black, Indigenous, and people of color. These departments' innovative approaches to a public health crisis that threatened to overwhelm our region's hospital and emergency service systems helped King County achieve one of the lowest rates of death due to COVID among the country's most populous counties. In short, thousands more people here lived through this pandemic because of the work of the staff in these departments. Here's just a sampling of the many things our award recipients did. Public Health helped set up and staff 7 isolation and quarantine sites where people could isolate and recover from COVID exposure or illness if they weren't able to safely do so in their home or a congregate living situation, or if they didn't have a home. A year later, these sites have served more than 2,400 King County residents, most of whom reported they were living homeless. Metro worked with its Access paratransit contractor to create a service that safely moved people with a confirmed or presumed COVID diagnosis to and from isolation and quarantine sites, medical facilities, homeless shelters, and assisted living facilities. The Transportation for Pandemic Response has provided more than 4,400 boardings, primarily to people who are experiencing homelessness. And Community and Human Services developed a shelter de-intensification plan to reduce the spread of COVID in congregate shelters where people are unable to physically distance. They did this by expanding space or by creating more single living spaces at shelters. But most significantly, they moved entire shelter programs from some congregate spaces to leased hotels. This allowed shelter guests to not only have 24/7 access to private rooms and bathrooms that promoted social distancing and hygiene, it created an opportunity for them to connect with the treatment and services they need to escape homelessness. King County's proactive and creative solutions to protecting the most marginalized people in our community, those who are at the highest risk of COVID infection and grave illness, they've been recognized and modeled nationally. And by extension, their efforts also helped protect the whole community. Congratulations to the teams in Public Health, Community and Human Services, and Metro, who banded together with many other departments in King County to help our residents navigate the pandemic. Your combined efforts have literally saved lives, and your innovative approaches have shown us new ways to address ongoing concerns like homelessness. There's probably no better demonstration of what we can accomplish when we act as one team. Congratulations.